Good morning, Ben. I'm going to have surgery for a umbilical hernia in a few weeks, and I was wondering what supplements you could recommend.
That's a great question. There are wonderful supplements to take. In fact, that's I don't want to say the best time, but it's one of the best times to make sure that you're supplementing before surgery and after surgery. The healing process begins as soon as the surgeon cuts into your flesh. That's when the healing process begins. So if you're loaded up with nutrients, you're going to heal much faster. You're going to get a much better prognosis from your surgery, and there's lots of good nutrients to take. Probably the first one I would think about is not really a nutrient, that's digestive enzymes. Taking digestive enzymes ahead of time can help reduce swelling and inflammation, and certainly taking digestive enzymes post-surgery can be very helpful for reducing swelling and inflammation, and all of that can have a negative effect on how well you heal and how fast you heal. So using digestive enzymes is very important. I'd be loading up on vitamin C. I'd be taking probably 5,000 milligrams a day minimum. Make sure you're sipping on the Beyond Tangy Tangerine, of course. That'll get you 1,000 milligrams of vitamin C and all your most of your basic nutrients. Vitamin K can be very helpful. You can use vitamin K two ways. Taking vitamin K internally before surgery can help prevent bruising or reduce bruising. Your doctor might not like that because vitamin K may affect how well may have an effect on the anti-clotting medicine, on the clotting medicine that they give you, the heparin and the anticoagulants, anti-clotting medicine, the heparin and the warfarin. Vitamin K is a pro-clotting vitamin. However, vitamin K is an anti-bruising vitamin, and it can reduce the effects of bruising. So personally, if it was me, I would be taking my vitamin K, 5,000 or so micrograms a day of vitamin K. Vitamin K2 is your best form of vitamin K. Again, that can speed up the healing process and reduce bruising associated with surgery. You can use vitamin K topically as well. If you get a vitamin K cream, a 5% topical vitamin K cream, you can either make your own, or you can, by crushing up some vitamin K and putting it in a cream, or you can have a compounding pharmacist make it for you. You can also, by putting it right on top of the area that they're going to cut, you can also improve bruising or reduce bruising, especially if you're having cosmetic surgery. If you're having plastic surgery, that might be really helpful for you. But for you, Dave, putting a little vitamin K cream may reduce the bruising topically as well as taking vitamin K internally. I'd be using topical vitamin A if I was interested in supporting healing, as well as making sure I got internal vitamin A, 20,000 international units a day internally. Using Retin A cream can improve the healing, the topical healing of the skin that is going to be cut. Let's see what else. Vitamin E may help, although vitamin E, again, your doctor might not like that because vitamin E has some blood thinning properties. But still, vitamin E can be very helpful for accelerating the healing process. 400 international units of vitamin E taken before as well as after. Make sure, absolutely, positively, that you're getting enough protein. You can't heal without protein. After you have a surgical procedure, your body is burning through protein. So making sure you're using whey protein, especially the amino acid arginine, can be helpful for wound healing. Same with the amino acid glutamine, which we spent so much time talking about. Glutamine and arginine, whey protein, those can all be important. And making sure that you're absorbing those nutrients using the digestive enzymes and apple cider vinegar after you take your protein, that can also be helpful. And then last but most certainly not least, essential fatty acids are very important for helping rebuild the extracellular matrix. That's the stuff that the cells are sitting inside after you have surgery. The body breaks down a little bit in response to the inflammation and the assault that the surgery represents. Using essential fatty acid can help speed up the rebuilding process. Lots of stuff you could do. Thanks so much for your call, Dave. That's a great question, and I hope anybody out there who's thinking about surgery will really take nutritional supplementation seriously, and also digestive impairment, making sure you're fixing digestive impairment so you're absorbing your nutrients. That's also important. Is that helpful, Dave?
I think it is. Thank you very much.
Thank you so much. And also, I should tell you, bone soup can also be helpful, using bone soup both before and after surgical procedures. Okay, Larry in Indiana, what's going on? Welcome to the bright side. Larry. Do we have Larry? Larry? Okay, I guess Larry dropped off. Going to move along here. Let's go to Marjorie in California. Welcome to the bright side, Marjorie.
Dr. Fuchs, yes, can you hear me?
Yes, ma'am. Go ahead.
Hello?
Yes.
Okay, I've got a customer that just started the Healthy Digestive Pack in the last couple of weeks, and a bottle of selenium, and a bottle of liquid glucogel plus. Okay. She's about in her, I would say, mid-50s.
Okay.
Or late 50s.
What's going on?
She exercises regularly. Okay. She before she started taking these, she's told me that she has pain in her muscles and her joints in her hands, and that she also has she describes it as a muscle pain in her right leg only.
Okay. Now, it's very not uncommon.
Since she started taking the supplements, she's saying that it's gotten worse, and now she has needles going through her right leg.
I wouldn't link them to the supplements. She could very well be getting worse, but I wouldn't link them to the supplements. Muscle cramps, leg pain, pins and needles, all that kind of stuff all represents a nerve issue. It all represents inflammation at the nerve cell level. All disease is cell disease. Once nerve cells become inflamed, once you get that microscopic inflammation and nerve cells don't get the nutrients that they need, they're going to start to fire incorrectly. They're going to start to fire inappropriately, and that's what a cramp is, and that's what pins and needles and all that kind of, technically it's called neuropathy. That's what that's about. Nerve cells that are surrounded with microscopic inflammation, nutrients can't make it through, oxygen can't make it through, and toxins start to build up. It's the same thing that we talk about all the time on this program. All disease is cell disease. What you're describing is nerve cell disease, and that means nerve cells are suffocated, starved, and toxic. Supplements aren't going to make that worse. However, if she's not absorbing her supplements, that can be a problem. Now, what I would be doing for this gal is I would be making sure that she doesn't have any absorption or digestion problems. So the Healthy Start Pack is great. And the other thing, you said a couple other things. I forgot what you mentioned there. What are the other? Glucogel caps. Yeah, you said the glucogel caps, the Healthy Start Pack, and you said one other thing. I don't remember what you said. Selenium, that's right. All that's great. All that's great, Marjorie. That's wonderful. Those are wonderful supplements, but we got to focus on absorption. If she's not getting the advantage of those nutrients because she's got some impaired digestion, which chances are she does, she may also be pre-diabetic. This is a very common cause of nerve cell inflammation, diabetes, and sugar changes as sugar builds up. That can also be a problem. So I'd be focusing, number one, on continue what you're doing, but you also want to add in some digestive support, probably the Biolumin Nightly Essence, digestive enzymes, apple cider vinegar, the whole digestive stuff, digestive support supplement program that we talk about on the Bright Side all the time. And then also throw in some sugar metabolizing nutrients too. Magnesium, the Osteomag, the Sweeties. Those are all very helpful for helping with sugar metabolism. Keeping her intake of sugar is also going to be important. Keeping her intake of sugar down is also going to be important, and that means limiting or restricting or ideally zero tolerance on processed sugar foods, fruit juices, cakes, pasta, rice, the kinds of foods, breads, cereals, those kinds of foods. Those can throw off the blood sugar system, and that can most certainly cause neuropathy. So, number one, add in some digestive support. Number two, add in some blood sugar support. Number three, have her stay away from foods that spike her blood sugar, the breads and pastas and processed refined carbohydrates. And then number three, she might want to see if she can link her muscle cramps, pins and needles, neuropathies, her pains to specific foods. See if she can notice when these kinds of symptoms flare up. Flare-ups are your best friends in a way because they're direct pointers to something that is getting into the body that is causing symptoms. So when her pins and needles sensation flares up, have her focus on what she did, especially what she ate, an hour, 2 hours, 3 hours before. And then I should also tell you, in addition to the electrolytes, which she's going to get from the Beyond Tangy Tangerine, using vegetable soups and vegetable juices can also be a wonderful way to get electrolytes into the system. But make sure it's not V8 or canned vegetable juices or processed vegetable juices. Make sure it's fresh veggie juices made in a Vitamix. Have her pay attention, though, to if she has any problems. Sometimes vegetables have some toxicity associated with them that she may be reacting to. So have her pay attention to how she feels after she uses her vegetable juices. But they're really wonderful ways to get these electrolytes, potassium, magnesium, chloride, and all of the electrical minerals, in addition to the B vitamins, which also function electrically. It's an electrical problem based on nerve cell breakdown, and that's how you want to focus.